Does your menses flow heavily? This is the cause. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, triathlon, the Lupus Day, the Lupus Day.
For this past 2 to 3 months, we've been having repeated cases of torrential vaginal bleeding in young girls aged from 15 to at least 30. So I wanted to use this opportunity to throw a little bit more light and educate the public on what excessive menstrual flow means and what might be the causes. Now, in medical terms, what we call excessive menstrual flow is menorrhagia. In a broader term, we can call them abnormal uterine bleeding. So now, as I am discussing about this, I am actually excluding other causes like postpartum hemorrhage that occurs after delivery, or postpartum hemorrhage that occurs after unsupervised induced abortion. And I'm also excluding every kind of bleeding that occurs in pregnancy. So I'll be talking about a regular menstrual flow, that is a lady that is within post-puberty, from puberty age, that is having a regular menstrual flow. Regular menstrual flow means that. So in discussing about menorrhagia, I would like to list the likely causes or conditions where menorrhagia would be seen. Before doing that, let me just explain a bit what might be happening to you, and you will start suspecting menorrhagia. Let me start with saying that at any point in your menses, that is your menstruation, where you suddenly start experiencing weakness, fatigue, and fast breathing as you are menstruating, please get to the hospital. You are likely having menorrhagia. Okay, now let me list these points. First, normal menses runs for approximately 2 to 7 days. That's normal menstrual period. Now, normal menstrual cycle is approximately from 21 days up to less than 35 days. That is normal. So now, at any point in your menses, in your regular menses means a menses that is approximately 28 days and can be predicted. So now, in this your menses, if you at any point discover that your period is running more than 7 days, it's likely you're having menorrhagia. Now, if also you discover that you are changing a pad per hour for several hours, full sanitary pad per hour for several hours, it's likely you're having menorrhagia. Your menses is coming out in clots. Every day you see a new clot, that is a cakey form of blood comes out from your genitals. It means you are likely having menorrhagia. Within the causes, I would like to divide them into 4 major bulk types. One is hormones. Second one is a uterine, that is when it has to do with the uterus. Then third one is when it has to do with maybe diseases, illnesses. Fourth one is when it has to do with medications or procedures. So by hormonal, what I actually mean is the 2 major hormones used that are implicated in menses are the gonadotropins from the pituitary. These gonadotropins include luteinizing hormone and follicular stimulating hormone. Now, the first hormone released during the menstrual cycle is called follicular stimulating hormone. What the hormone actually does is it mops up follicles, and rescues them from atresia. So then a dominant follicle is formed. It does so by releasing large amount of estrogen and minimal amount of progesterone comes in. Then what the luteinizing hormone does is it creates a surge, increases. So the increase helps the dominant follicle to rupture. When it ruptures, it releases ova. The ovum release is called ovulation. This process is called ovulation. Now, at this point, estrogen, that the surge in luteinizing hormone also results in producing, goes down to the uterus and starts causing what we call endometrial hyperplasia, more like endometrial growth, to help prepare the uterus for implantation if fertilization occurs. Now, the situation where fertilization occurs, as the sperm goes in and fertilizes the ovum, what happens is the remaining pieces of follicles from the dominant follicle, that is when the remnants now come together to form what we call corpus luteum. Corpus luteum now produces progesterone. The effect of this progesterone is there's this classical disease we know as PCOS. I'm still going to go to diseases, but I just want to mention this here. Polycystic ovarian syndrome can lead to what we call anovulation. Now, in this anovulation, there will be excessive production. There's no ovulation, so there will be excessive production of estrogen. This estrogen causes hypermaturation of the uterus, of the endometrial wall. And it gets to a level where, because there's no opposing progesterone coming to limit it, the next thing that happens is it sheds. So there will be excessive bleeding. And that is what you call menorrhagia. Now, the hormones are also implicated in things like type 2 obesity, where there is excessive insulin and insulin insensitivity. So if insulin stimulates the ovaries to produce excessive androgen like estrogen, and the cycle continues, it still does what I mentioned. The estrogen causes hypermaturation of the endometrium. So that is it about hormones. Now, coming down to uterus, the way uterus is implicated is if there is fibroid or polyp. The uterine wall is able to stop bleeding by stimulating fibrin production, that is stimulating coagulation. Fibrin is imported through the blood to coagulate any bleeding vessel. Or on its own, it has its walls. The walls are trabecular, so the walls of the uterus can contract and cause vasoconstriction of the vessels there. So, but areas where there are fibroid or polyp becomes weak. So this contraction can't actually work. And then the fibroid on its own can bleed because it has a different blood supply from the uterine wall blood supply. So on its own it can bleed. So that means you're now having two different sources of bleeding from the fibroid, bleeding from the uterus. So that is why it can cause menorrhagia, especially submucosal fibroid. That's with the uterus. Then the next one we're going to is diseases. Diseases like von Willebrand factor or any disease that affects coagulation, disseminated intravascular coagulopathy. All these things can result in menorrhagia. And then if you also insert contraceptions like intrauterine cervical device, IUCD, advising anybody that is having menorrhagia to please go to hospital. Thanks and God bless.
Dr. Okafor Chidumeje, CEO at Dr. King Foundation Nigeria, convener, Tritathlon, the Lupus Day.